the first steps, the title of our presentation is called Progressive Steps. And the reason that we chose the term Progressive Steps is in October 2021, we presented the initial part of our study, and at that time at the CMSC was called the first steps towards implementation of a standardized protocol in British Columbia for patients with multiple sclerosis. And at that time in 2019, we had done a survey of MRI centers in British Columbia, and we discovered that although standardized protocol is something that has been around for many, many years, and in fact, the first meeting that we had for a standardized protocol occurred in the year 2000. So it's been around for a long time, but disappointingly, people, even though they're aware of it and know the importance of it, have not been adopting it as widely as we thought. And so when we did our survey in 2019, we found that of 15 centers that responded to our survey, only 2 were fully compliant with the protocol at that time. And so we presented our results to the Medical Imaging Advisory Committee, which advises the British Columbia Ministry of Health in terms of health practices. And we presented that to the advisory committee. They were obviously sympathetic and felt that it would be important for the province to adopt a provincial standardized protocol so that patients with multiple sclerosis would be able to benefit from it. And so a protocol was established, and it was then circulated to all the different health authorities for them to pass on to the MR centers. The protocol that was agreed upon in British Columbia is very similar to the international MAGNIMS CMSC NAMES protocol that was a consensus protocol that was published in the year 2021 and published in Lancet Neurology. The only difference between the British Columbia protocol and the recommended protocol from MAGNIMS is that we had an additional sequence added onto our protocol. And we felt that it was important to add that on because we were very interested in being able to observe changes in brain volume. In other words, whether the brain changes in size over time. For the international consensus recommendation, this was an option. It was not one of the recommended core protocols. And the reason that it was not a recommended core protocol was because many centers are not able to do it or be able to benefit from doing it. But here in British Columbia, we felt that if we could get that to happen, it would be something that would be of additional benefit. And so we added that to our protocol. But otherwise, the protocol is essentially similar to the recommended core for the international recommendation. So that protocol was then widely disseminated. And then we repeated the survey in 2022. And by then, of the 15 centers that had responded initially, we had 2 back in 2019. We now had 11 out of the 15. So a real great improvement from about 13%. Now we're close to about 75% of centers. Additionally, there were 17 new centers that were here in BC, and they responded to the survey. And out of those 32 centers, 27 of them were familiar with the protocol. In other words, they knew about the protocol. But only 18 out of those 32 were fully compliant. So the numbers there are better than 2 out of 15. They're better than 13%. They're up to about 56, 60% of centers. But still, if the ideal, if patients are going to benefit, particularly as people move from one center to the next, it would be great to be able to have this adopted in 100% of the centers. So although things have improved from 13% now up to 50 to 70%, we still have a bit of a road ahead of us, and it will require really individual discussions with the centers to try and let them know where things are different and how we might be able to help them. Obviously, different centers have different scanners, some older and some newer, and much easier to adopt in centers that are newer with newer equipment. But it's something that will require time. And so it's progressive, but we're encouraged that people are aware of it. People want to do it if they can, but obviously there are limitations.